She lovely. Isn't she lovely? Of course I am lovely. Yes, thank you very much for saying that. I know, I know. This is Breakfast in Bed here on Smooth 98.1, and the conversation we're about to have is even lovelier because it pertains to your health as usual. We care for you, we love you, we appreciate you for listening, and we want to tell you something that you can do to help yourself better, especially when it concerns your body and, of course, your esteem. It could affect the quality of life. I am talking about the topic of alopecia, and I already have my guests in the studio. Are you a part of our WhatsApp family, or are you a part of a YouTube family? How about you go to YouTube right now and search for Smooth 91 FM Lagos? Click on that subscription button and then that notification bell so that you do not miss out anything going forward. Yes, you can also drop your messages, your questions, comment, feedback, whatever it is in the chat box option. Or you could come to WhatsApp on the number 0809 444 0981, or you could call 01448 9981. We've opened many avenues for you just to be a part of the conversation and to have your voice heard and your questions answered. Now, that said, I have in the studio a senior consultant with one of the world's leading specialists as concerning hair restoration. He has actually consulted over 2,000 patients that are experiencing varying forms of hair loss, and he has extensive experience when it concerns the treatment of hair loss with options, different options, from the medication to laser cap technology to hair transplant surgery. So if you belong to the camp of those who have a receding hairline and you are very worried what to do about it, I think this conversation is for you. Gather everybody, quickly send this link to them and tell them, see, remember what I told you about your hairline? How about you listen now so that you know what to do? Now, my guest has published several articles in the professional journals and newspapers and has been featured on local and international media platforms just to share his wealth of knowledge concerning this topic, and that is why he is here this morning. Ladies and gentlemen, men and women, I am talking about the senior consultant, the regional CEO for Vinci Hair Clinic Africa, Mr. Ayo Otubanjo. Good morning.
Good morning, everybody. Good morning, Luasham.
Thank you so much for being here this morning and, of course, ready to share that wealth of experience and of knowledge on the topic. How are you doing this morning?
Very well, very well. What a flattering introduction.
I say it as it is. I'm sure you are probably thinking, oh, I have done that much. Well, of course you have. All right, so let's get down to the topic of conversation this morning. Let's start with the basics. I mentioned earlier while I was giving an introduction and, of course, laying the background for this discussion that if there is nothing that was remembered from the Oscars this year, it was the incident between first Will Smith and Chris Rock. And, of course, the bone of contention was alopecia, bald head, that was made to look terrible and bad. So as a result of that, a number of people came to the awareness of that condition. So let us define it first. What is alopecia?
Right, okay. Alopecia, it's actually a Greek word meaning hair loss. So it's a generic term used for all forms of hair loss. And you've got to remember there are so many different types of alopecia. You've got the alopecia areata, alopecia, the androgenic alopecia, alopecia totalis, traction alopecia, and that's just to mention a few. So the type of alopecia that Jada had, which sadly became the butt of joke and with all the regrettable incidents, was what we call the alopecia totalis, which basically results from a medical condition, an underlying medical condition, which causes loss of hair. And it could be a loss of hair just on the scalp, or it could be loss of hair all over the body, which is why they call it totalis. So you've got that, you've got the genetic form of alopecia, the androgenic alopecia, which is very common. You probably find it in about 70% of men, and possibly about 50% of women, which is basically a form of hair loss which is passed down through the genes. And then you've got traction alopecia. Traction alopecia is one of my favorite ones because
Why?
you see quite a lot of that, especially in Nigeria. And
Okay.
the number of Nigerian ladies that uses wigs to cover up this form of hair loss, it's quite remarkable.
Okay, so I like the fact that you have talked about some of the alopecia. We have areata, we have totalis, we have
Androgenic.
androgenic, we
Mm.
have which other one?
Traction.
Traction. So
Mm.
let us take this alopecia one by one and discuss them in terms of their unique presentation of
Sure.
symptoms and
Mm.
how you can identify them. Let's start with your favorite, which is traction alopecia. How does traction alopecia come on?
Right. Okay. So traction alopecia, as the word implies, means traction. When you're pulling something, you're basically exerting a lot of pressure, and that's where traction comes in. So if you imagine when you go to the salon and you're doing, maybe tight braiding, you could imagine your hair being pulled. And I've heard this experience being narrated to me so many times by women. The hair is pulled back to such an extent that you develop a headache. It's just too painful to describe. Now, what happens is the follicles, which are the roots of the hair, especially in that frontal bit, they're probably the weakest of all the follicles on the scalp. So the constant tugging of the hair weakens those follicles, and eventually they die. And that's why
Mm.
you got that receding hairline you see a lot of in women.
Whoa. So the more you pull the edges tight, even though the tighter the edges, the shinier your face, the better you look.
Absolutely, yeah.
But it comes with consequences. All
Hmm.
right. So let's go to alopecia totalis.
Mm.
What causes alopecia totalis?
Right. Okay. So there is an underlying medical condition that actually results in alopecia totalis or universalis. So typically, one of the medical condition is it's a general term called autoimmune diseases. Now, autoimmune diseases manifest in several ways, and probably the most common one is lupus. A
Mm.
lot of people might have had experience of a loved one developing lupus. Whilst there isn't any cure for it, sadly, it can be managed. But one
Mm.
of the side effects of developing lupus, obviously, is loss of hair.
Mm.
And like I said, it could be just universalis, which is just on loss of hair on the scalp, or it could be totalis, which is loss of hair on the scalp and bodily hair as well. So and there's no cure. There is no cure.
Okay. Before we get to the, let me not say the depressing side, let's further go to alopecia. So that, let me get it straight. There is a difference between universalis and totalis. Totalis is the whole of your body.
Correct.
Universalis is just your
On
head.
the scalp, yeah.
Ah, all right. So what about alopecia androgenic?
Right. Okay. That androgenic, as the word implies, means there's a genetic basis for the hair loss. So you would typically see a lot of men walking around with a typical U-shaped baldness, and they basically inherit genes from either the mother side or the father side. So if you go back into their family background, you probably find the mother or the father or the grandparents have had issues with hair loss. Now, it's not inevitable that you will develop androgenic alopecia, but the propensity and the likelihood is much higher when that gene actually exists within the family.
Mm.
So that's how it manifests in men, the kind of U-shaped baldness. In women, it's more diffuse in the sense that it tends to follow the middle part of the scalp. And the middle part of the scalp starts thinning out just to the sides. And eventually, you end up with very thin or, balding hairline, or no, not hairline, but the balding middle part of the scalp.
Oh, now that you said it, I actually can recall some pictures and some people that was actually. You know what? I will not reveal that. We'll come back to it. But you know what? We will also take some minutes or so, few minutes, so that you can go grab a mirror and check your hair to know which of it we have discussed. Alopecia. No, we didn't talk about areata. We talked about totalis,
Carburetor.
universalis.
Yeah.
We talked about androgenic. We also talked about traction. So grab a mirror and look at the one that you have on your head. If you do not have it, well, good for you. You're talking about alopecia. We have talked about few of the types. From alopecia universalis, I am reminding you because I am a good student, to alopecia totalis, to alopecia areata, and of course androgenic and traction alopecia, which is said to be very common in women as a result of the hair making procedures. So let's go back to alopecia areata. I'm not sure we are fully defined what that is and the causes.
Right. So alopecia areata, in a way, similar to alopecia totalis or alopecia universalis. The only difference, basically, is the pattern of the hair loss. So, for instance, you go to bed night before, all everything fine, and you wake up next morning, all of a sudden you see a massive patch of baldness on your scalp, and you're wondering what happened in the middle of the night, and it's nothing to do with spirits or anything. This is simply a medical thing. And what happens? We still don't know a great deal about why it happens like that, but it's a very sudden loss of hair, but it's not total. So, like I said, it's all in patches. And one thing we've found, and especially from the consultations I've done, is there are certain common themes that runs across all the patients. They're usually people that have been through a lot of trauma. They're going through major changes in their lives. So maybe death of a loved one, or divorce, or a loss of a really cherished job. So something really significant has happened, and it places a lot of stress on the body, and it's the stress that it places on the body that results in that sudden loss of hair. So that's the difference between alopecia areata and alopecia universalis or totalis.
Well, since you've touched on it, let's talk about some possible risk factors or things that could predispose to having alopecia, especially the ones that is triggered by the immune system.
Mm.
Is it possible that childbirth could be a risk factor in women? Because there were some women who had really full hair before having a baby,
Mm.
and afterwards it's just as if the hair keeps pulling out and it's short, it's breaking, it's no longer very lush like it
Mm.
used to be.
Mm. Right. I mean, I've been asked this question so many times. Basically, when you're pregnant, your estrogen level, which is you know what estrogen is,
Yes.
your estrogen level rises. It's elevated. So basically, what that does, it creates more volume of hair. That is why you see a lot of pregnant women looking absolutely luscious. They have wonderful hair. That is part of the high level of the estrogen in the body during pregnancy. Once you've given birth, the estrogen level goes down to the normal, and all of a sudden, the volume that you experience during pregnancy is suddenly lost. It doesn't mean you're losing hair. You're basically getting rid of something you never had. Okay,
Wow.
so that's what happens. And it's a natural thing. We call it a fluvium, which is a form of hair loss, which it's not caused by a particular illness or anything. It's just simply that you developed a massive volume of hair during pregnancy, and when after delivering, the volume goes down.
Is
Simple.
that what also happens with aging and hair loss? Because over time, some people's hair thin out and
Yeah.
it's no longer as full as it used to
Mm.
be.
Yeah, the aging bait I've never really subscribed to. I mean, I think you've seen Professor Wale Soyinka. That's a very good example, actually, of somebody in his 80s, with massive afro. So
Maybe he needs to drop his hair care procedure.
maybe it does. No, I think, yeah. I mean, there are instances where the older you get, the thinner the hair becomes. Um, that could be genetic in a
Mm,
way, or it could be nutritional.
exactly. Okay. All right, then let's go further. So, aside the obvious hair loss with alopecia, are there some other symptoms that could come with it?
Yes, I mean, this is the reason why we have to diagnose exactly the particular type of alopecia somebody's experiencing, because they all present different symptoms. So, for instance, alopecia areata, I've already described the patches of baldness on the scalp, and alopecia totalis or alopecia universalis. When you look at the scalp, you know there's absolutely nothing there, and you cannot find any trace of follicles. You know exactly what you're dealing with. Attraction, that attraction is actually quite easy to detect, because you could see the hairline where it used to be, and then you see where it's ended up. After several years of of doing the kind of damaging hairstyling. So those are the kind of symptoms that we tend to look for. Now, a lot of the consultation is all about questioning as well. We don't necessarily believe in unnecessary tests. I mean, I know this is a very common thing in Nigeria. Every little thing, go for
We
a test.
test.
There are several things that you could actually ask, which would lead you to the particular type of alopecia somebody's going through. Tells you, and you could actually have a visual examination of the scalp to see how bad the thinniness or the baldness, and then be able to recommend the appropriate solution.
Okay, that's good then. All right, so let's talk about Treatment. Or before we even go to the treatment procedure, a little bit about men. I don't think men make hair, but over time they just have the hairline receding.
Yeah.
What is wrong? What causes it?
Well, this is androgenic alopecia.
Uh,
That's the genetic form of hair loss. Like I said earlier, when if you look around your family members and you see men, with receding hairline or that U-shaped pattern baldness, it's not definite that you will end up like that, but there is a high propensity that you might. So what I suggest is you to look out for the signs, the early signs, and the early signs are very simple. When you start feeling the top of your hair and it starts getting soft, the hair fiber starts getting soft in texture, like baby's hair, like cotton wool, that is the beginning.
mm.
So that's the point where you need to then say, I need to do something about this. Because if you don't, maybe a few months or maybe a year or two, you will lose that hair. And then you then end up having to have a surgery. Whereas, picking it up that early could be just a mild medication.
But there are some medical conditions that could also result in, say, temporary alopecia.
Yes, I mean, like I said, I mentioned the alopecia areata,
Yeah.
which is a temporary form of hair loss. We don't really know a great deal about why it happens, but I mean, from my experience, the common theme that's gone through all the people I've consulted with, they've gone through life-changing experiences, and that places a lot of stress on the body, and that's the reason why they've experienced this hair loss. Um, but alopecia, androgenic alopecia, well, there's really nothing you can do because it's part of your genes. All you need to do is to watch out for the signs, the early signs. And like I said, it's the
Staining,
texture,
yeah.
yeah, of the hair. You need to really watch out for.
Okay, since you can really help yourself if you have had it, maybe when you want to marry somebody, if that decision is still in your hands, go for somebody who has full hair so that you can help your future generation. All right, let's talk about the treatment. What are the ways you can get yourself rid of this thing that just makes your hair go away?
Right. Okay. There are several treatment options. So if you imagine a spectrum of treatment option, from one end of the spectrum, you've got medication, and you've got stuff like minoxidil, you've got finasteride, you've got sulfamelto.
What are those?
Those are basically medication that have been approved by the FDA in the US for the treatment of hair loss. So, I wouldn't advise you to go and get anything being advertised on the online. You need to make sure that you're buying the genuine medication that's been authorized and approved. So, starting from medication, and then we've got some therapies that we deploy for certain types of hair loss and the extent of the hair loss. So, therapies such as mesotherapy, which is a form of injecting topical medication and some vitamins directly into the scalp. And then we've got platelets rich plasma therapy, which is a form of taking your blood and in a process of spinning in a machine extracts the plasma from the blood, which has a lot of nutrients, and then injecting the plasma back into the scalp. And then we've got corticosteroid injections, which are, very effective for alopecia areata, for instance, somebody that's had a and then, you've got the cosmetic procedure called scalp pigmentation, which for some men have actually gone bald and they've gone extensively bald and do not want surgery. That is one way of camouflaging their baldness. so,
How does that happen? How do you do it? You
so
color the scalp?
yeah. So we pigment the scalp to make it look like they have hair. So they just have to maintain a shaved look, but you could still see that.
Wow.
Um, and then moving along the spectrum, you've got the hair transplant, which is a surgical procedure whereby we're basically taking healthy donor follicles from one part of the scalp and implanting those follicles where we want new hair growth. And then we've got non-surgical, non-medication treatment like the laser cap, which is a self-administered therapy. So, when your hair is thinning, especially for thinning hair, you could just purchase the laser cap and really, apply the therapy yourself at home, in the office, or wherever.
How does that work? You just put on the cap, or is it a cap?
It's a cap, so it's basically a laser
Yes.
cap. So inside the cap, there are several laser, where once it's plugged in, it emits very powerful laser lights. Those powerful laser lights stimulate the existing follicles and give them energy because that's what laser does, gives you energy. And that's what gets those follicles to start getting stronger. And when they start getting stronger, that's when they produce stronger hairs, thicker hairs.
Is it possible that there are some people who have a case of dry bones can't rise again?
I never subscribed to that. I mean, the of course with alopecia totalis and universalis, we still haven't found an effective cure for that, or in fact, any cure for it. But for the vast majority of people, yes, there's always a solution.
So dry bones can indeed rise again.
Indeed,
Okay, so in the case of hair transplant, you mentioned taking healthy hair from a part of the
donor
head,
follicles, yeah,
yes, to another part of it. What if
correct.
the person has entirely, the person is bald already? Where do you take hair from?
Well, this is the thing, and this is the problem for people that have alopecia totalis or universalis, because there aren't any viable follicles, to take. One experimental development, though, in the hair loss field is the use of stem cells. Now, we've been talking about it for a few years now. It's still very much in the experimental stage. And as far as I know, only the Italians and Americans have been doing the research on this. And basically, stem cell is all about taking a tiny bit of skin tissue or even whatever it is, and by taking that sample, you could culture that in a lab environment to generate as many cells as you need. And, follicles are cells. So that way, if it's proven and if it's proven to be effective, it's possible that somebody without any hair, like somebody with alopecia totalis, will be able to have a full head of hair. But like I said, we're still years away from it because we're still at the research experimental stage.
Okay. While you were talking about the different treatment procedure, I was thinking about the needles and the needles going to the scalp. Is there the possibility that any of this could be painful, number one, and could have a side effect on the brain?
No, no, no. We're not going anywhere near the brain. That's number one. And then the other thing is we like to make our patients as comfortable as possible. So there are several numbing anesthesia that we normally apply. Either a cream if you're doing a non-surgical procedure, or we actually inject local anesthesia when you're having a surgery. So the whole point is to make the experience as painless as possible.
So if a person undergoes the hair transplant surgery, what's the space of time that the person can have back a hair full of head?
Right. Okay. So it's hair surgery or hair restoration is a patient process. You're not going to have an afro after a week of doing a surgery. Yeah. So you would normally start seeing the follicles that we've implanted start producing hair literally after 3 months. And it's really only between 6 to 9 months that you get the full effect of a transplant. So it's really a patient process.
What would you say has been the reception of Nigeria to this? Because first, let's even start with the prevalence of alopecia in different forms.
Yeah.
I can say for a fact that we do have a high number of traction alopecia in women, then androgenic to an extent in men,
Sure.
but then generally the prevalence of alopecia and also the reception of Nigerians towards the different treatment procedures.
Well, so since we started back in 2014, we've had a lot of clients come to the clinic, and the vast majority have never understood exactly what they were going through, and never really understood that there was something they could do about it. So they've been very grateful that we offer free consultation.
Did you just say free?
Yeah, free consultation,
Oh,
yes.
wow.
And we're able to enlighten them as to what caused their alopecia and what they could do about it. So it's been a real beneficial experience for a lot of people that have been to the clinics.
Great. So now on a final note, as we are rounding off, what will be your advice for somebody who's out there who's worried, especially the one who's thinking I will lose my hair in some years, looking at the condition of things now and many other things?
Right. I mean, just take reasonable precautions when you go to the salon. Don't do anything that would put you at risk of hair loss, especially traction. If you look around your family and you see a lot of baldness or balding people, then try and be mindful when your hair starts, getting soft, like I mentioned earlier. But the main thing is that, look, for the vast majority of people, there is a solution. There's always a solution for the vast majority. So the best thing really is to come in to us and tell us, let us have a look at you and see what we can do for you.
Sorry, just to clear this up. So, for the now that you mentioned that there is a vast, or rather, the solution for a vast majority, those who have alopecia as a result of autoimmune disorder, is it possible that even after getting, say, hair transplant done, the body could still attack those?
We still don't know. We still don't know about that. But I mean, even if the stem cell research that's currently going on eventually becomes an effective form of treatment for this particular type of alopecia, we still don't know whether the body will not reject those cells. So it's unknown.
So, what will be a word for somebody who's battling alopecia as a result of autoimmune disorder?
Take heart. There are other things we could do for you, which, for instance, the microscopic pigmentation, which doesn't grow hair, yes, but it will at least give you a modicum of self-esteem. And I've seen a lot of beautiful black women without hair, but with a nice shaped hairline, and they're rocking it, as they say.
Yes, when life gives you lemon, squeeze the lemon back at the life in its face, and of course, make lemonade out of it, because you just have to drink something and refresh yourself, and life must go on. Thank you so much, sir, for being my guest this
Thank you
morning.
for inviting me.
I definitely look forward to more conversations around hair transplant and, of course, hair solutions.
Sure.
Yeah.
Thank you.
And if you have missed out on this conversation, there is still time for you. What you can do is go back to our YouTube channel and catch up on the repeats. What you're searching for is Soul Food 981, alopecia, causes and treatment. And you can also share that with somebody. Share the information with somebody or someone who you think, well, you are towing the line of incurring traction alopecia on yourself. So you should take precautions and be careful. So share that information with them and spread the word around. Tell somebody to tell somebody. You can check out Vinci Hair Clinic across all social media platforms. On Instagram, it is Vinci Hair Nigeria, and of course on Twitter to Vinci Hair Nigeria. Get more information, get more enlightened, and of course reach out to them and tell them what it is that you're battling with, and they could have help for you. Again, thank you for being my guest.
Thank you, Luashim. Thank you.
All right.